Twinkle, we are starting your tooth extraction, and how are you feeling about it?
Bit nervous, definitely, and a bit scared as well. I hope it goes well.
Yes, of course. Definitely, you
I
don't
hope
need
I'm
to
in
worry.
safe hands.
Of course, 100%. So, wish you all the best. Let's start the
Thank
process.
you.
So now I'm cleaning the skin with betadine. This is to make sure that no infection or dust particles or bacteria travel from the skin surface to the surgical field inside the mouth. And this is an autoclave sheet for the same purpose. So after giving local anesthesia, this is how I am making an incision to the skin inside the mouth, which we call as mucosa. This is to separate the gums from the underlying bone so that we can cut that bone and remove the tooth out. So this is how we are separating the gums from the underlying bone after making a cut over them. And now we are cutting that bone which has engulfed the tooth from a couple of sides so that we make it free and we can easily take it out. So this is how we are cutting the bone. And after that, when the tooth is free from the bony intents, now we can take that out with the help of certain instruments. And this is how the tooth is free from the socket, and now we can take it out. So we understood that the intent of this surgery is to make the tooth free from the bone because the bone has covered it. For that we need to first remove the gums, then we have cut the bone, and now we are taking out the tooth. So after our tooth is out, we need to clean that socket because there are some bone chips, there are remnant tooth fragments. We need to remove them all, and we also need to thoroughly clean all the source of infection and debris from inside the socket. So this is how we clean the socket. And then now the last thing is to put some stitches over this surgical site, because these stitches will help us to make the healing happen faster. And if that empty space will be closed up with these stitches, then no food particles or any infection will travel inside that part to our bone. So these are some minor stitches, and we will cut them after a week. So this is how wisdom tooth extraction is done.
So, Twinkle, the tooth is out, and I hope you are comfortable and you didn't have any discomfort during the procedure.
Absolutely, yeah. It was painless, and I was very comfortable throughout. Thank you so much.